Good afternoon and welcome to the Senior Hour, which is sponsored by Providence Holy Cross Medical Center and Comfort Keepers in Home Care. I'm Barbara Cochran with my co-host,
Dr. Thomas Pilecki.
on your hometown station 98.1 FM, AM 1220 KHTS. This is a show for, about, and by seniors, giving them information to enhance their quality of life. And our guest this afternoon is Sandra Wallenman, and she's a palliative care nurse practitioner at Providence Holy Cross. It's good to see you again. It's been a long time.
Yeah, thank you. Thank you for having me.
Everything good in your world?
Yes, everything's good.
And you're busy.
Yes, we're very busy, for sure.
Now, what is palliative care?
Sure. So palliative care is a specialty in medicine. So we're a medical specialty, just like any other medical specialty, cardiology, nephrology for the kidneys. So our area is whole person care, and we see patients with chronic or serious illness that could use an extra layer of support. So we really focus on the whole person. We do symptom management, psychosocial support, spiritual support, and also advanced care planning for patients. I work in the hospital, but there's also palliative care outside of the hospital.
So do you go to people's homes?
So we do have a group that does go to people's homes. So I work just inpatient in the hospital, but we do have a home-based palliative care group with a physician, nurse practitioner, nurses, social workers that go into patients' homes and support them in their homes.
Ah, interesting.
Yeah.
So, what do you feel is the importance of holistic care in the realm of palliative care?
Sure. So like I said, we see a lot of patients with chronic and serious illness. So when patients get older and have a lot of chronic illness, they have a hard time managing their medical care. It's very complex. They have diseases that are going to be with them for the rest of their lives. So our focus is really on educating patients regarding their chronic and serious illnesses and empowering them to make their healthcare choices based on who they are as a person. So that's the key. We really look at the whole person and empower those people and their families to make the best decisions for themselves.
Okay, go ahead, Bob.
So you work with the entire family then?
We do.
I see.
Yes. Yeah, because obviously the patient is also not only themselves, but whoever they call family supporting them.
And I know that nurses are the heart of healthcare. I was raised by a nurse, and palliative care is just another step.
Yeah.
Above what we have come to see conventional medicine as.
Right.
What's your role as a nurse practitioner?
Sure.
What does a typical day look like for you?
Sure. So I'm a nurse practitioner, which means that I'm a registered nurse that's been educated I'm master's prepared. So I'm educated to be able to diagnose, treat, and support patients in that area. So I work in the hospital. Like I said, we're a consult service, so I support our physician. I see patients throughout the hospital, from the emergency department, intensive care unit, medical units. I meet with patients, assess them, see what their concerns are. I educate them. We do advanced care planning, like I said, and we work a lot with all the other medical specialties as well, to make sure that patients have good understanding about what's going on with them medically, and then we help them by educating them and then helping them in their decision making as it pertains to their health.
Right. So there's a lot of plates to spin there.
Yeah.
How do you keep track of the team? Like,
Yeah.
the interactions between the doctors
Yeah.
and the nurses
Right.
and the family
Yeah.
and
Yeah.
the patient, of
Right.
course. I
Right.
mean, how do you make all that work.
Yeah, so our area of medicine is really unique because our area is all about communication and relationship building. So we really are the glue. So we're constantly having conversations with the physicians, with the nurses, with the physical therapists, the speech therapists, the family, the patient. We're kind of the glue that's looking at the big picture and bringing everyone together. So really to work in this area, you have to be, have good interpersonal skills and be able to talk to a lot of people and really bring it all together and, really work as a team for the patient.
So do you work with Dr. Kalani?
Yeah. So I'm her nurse practitioner, and then we also have two registered nurses that we work with as well on our team in the hospital.
Now, have you ever thought about going further and becoming a doctor yourself?
I considered it before I went back to school to become a nurse practitioner. I considered it and what my goals were and everything, and I decided that being educated as a nurse was something that was closer to my heart. So I decided to go that route because as a nurse practitioner, we are educated in disease management, diagnosis, treatment, and all of those things. But we're educated under like the nursing perspective, so still very holistic and
actually taking care of people.
Yeah.
Whereas a doctor sees you for 20 minutes and asks you questions and, okay, see you next month or see you 3 months from now.
Yeah. I mean, doctors, they're so busy and they're very highly educated and everything that I think a lot of physicians do appreciate having the support of nurse practitioners and physician associates in order to, help them with the load that they're dealing with so they can do a little bit more of the complex medical cases, and then I can support Dr. Kalani, so we can be able to see all of our patients. We're a pretty busy service. So.
Yeah. Now, how is she doing?
She's good. Yeah, she's good. She's doing well, and our team's doing well. We see a lot of patients, but we're, we function well together. So.
Terrific.
Yeah.
Terrific.
Yeah.
And what inspired you to take the extra step? Nursing's hard enough, but to go back to school for, what was it, an extra 4 years?
Yeah, so it's an extra 2 years. So you're educated as a registered nurse and you have a bachelor's of science degree in nursing. And then you go back to school and are educated for another 2 years to get a master's of science in nursing.
Right.
And then, you take your exams after school and everything like that. So really what inspired me was I became a registered nurse and I started working in the space of oncology with cancer patients and supporting them. I was an inpatient bedside nurse doing oncology, hematology and oncology. And in doing that, I saw people who were very seriously ill, who were kind of going through the motions and who maybe didn't have a full understanding of what was really going on with them and what their options really were.
Yeah.
And that, was sad for me as a nurse because obviously you want the best for your patients and you want them to feel empowered and to be able to make decisions for their life. So that kind of inspired me to go back to school to become a nurse practitioner so I could now have that voice and I could be in that position where I could, be able to educate patients and give them that, control back. And then, I kind of naturally found my way to palliative care through my work in oncology, taking care of seriously ill patients. And now I get to take care of oncology patients, but also a wide range of patients with chronic and serious illness. And, it's very good. It's very fulfilling.
When I went through, I've beaten cancer twice.
Oh, wow.
And Dr. Black was my doctor. And I would go up into somewhere over there somewhere where I would sit in the chair and have the treatments.
Oh, dear.
Now,
Yeah.
did you work in that area? Because a lot of nurses
Yeah.
work.
I'm assuming
with-
that was like an outpatient infusion center that you were
Yes,
going to.
yes,
So I never
through
worked.
UCLA.
Yeah. Oh, nice, nice. So I didn't work in the outpatient space. I worked in the inpatient space. So when
Oh,
patients were
okay.
admitted to the hospital, I did still administer chemotherapy and things like that. We did like bone marrow transplant and chemotherapies and stuff like that. But I was taking care of the patients who were more acutely ill, but also had cancer.
Yeah, I still have my, whatever you call it.
Port.
here, my port.
Oh, yeah.
Yeah, Dr. Black said, no, let's don't take it out
Sure.
yet.
Let's not mess with it. That makes
Leave
sense.
it alone.
Yeah. Oh, God.
Well, I beat it in my 70s and I beat it in my 80s.
Oh,
And I
nice.
told my kids if I get it in my 90s, I'll beat it then too.
That's right. That's right. I love it. That's great.
And I'm not that far from 90 either.
Aw. Nice.
So we've touched on, your training, which is impressive, and kind of what you do in that realm of, when you show up to work, what you're faced with every day. So specifically, because it is a very sensitive subject. I mean, this
It
is life and death stuff.
Yes, it is.
Yeah.
How do you support the patient and their family going through that?
Yeah.
Those are some
Yeah.
hard conversations
It
at
is.
points. So
It
what
is.
is that like?
Yeah. So it definitely took some time. It took some time for me to get used to the role, to find my grounding, to find my words that I wanted to use. And a key for me is always to lead with both honesty, but also compassion.
Yeah.
I really believe in being honest and not sugarcoating things. I don't think that helps anyone. But doing so in a very kind and loving and compassionate way, which I think sometimes is a hard balance to find.
Yeah.
And also very important is reading the room. When you enter a room, looking at your environment, the people that are there, feeling kind of their vibe and what's going on and understanding and then leading with that. Because sometimes people aren't ready to hear certain things.
Yeah.
And you don't want to, lead with something and someone's just not in a space to hear it.
Yeah.
So that's a very important part of my job as well.
Sure. Yeah.
Most important, probably.
And thank you for your service. I know everybody says that to like military and stuff,
Yeah.
but I think it's more practical
Yeah.
to say that to a nurse.
No,
I mean,
thank you.
this is like the
Yeah.
front line that everybody is going to face. This
is.
is
At
the
some point,
battle
at
that
some-
everybody is going to face.
Yeah.
At some point, yes.
Some people
yeah.
get paid to go and put their life on the line, but everybody's going to face this one.
It's true.
So thank you for your service.
Of course. It's my pleasure, definitely.
And
For your service.
so, what are some of the most challenging aspects that you find in your role as a nurse practitioner in palliative care?
Oh, sure, that's a good question. I think sometimes it's very challenging when, patients just aren't ready to hear certain things, and you can kind of see the trajectory of what's going to happen, but they're just not in a place to receive that. So you
And neither are their family.
Right. And really, in all honesty, that's something you have to learn too, is meeting people where they're at in their life and realizing it's not your responsibility, it's their life.
Yeah.
It's just my responsibility to empower them to give that information, but then their decision is their decision. So I think one of the most challenging parts is, being there, supporting them, but then maybe they don't fully grasp what's going on, and they make a decision that's going to potentially lead them down the path to, suffering and pain and things, but also knowing that, this is people's lives, and
Yeah.
they, as long as they know their options, they can make the decision that they want to make. So
That must be hard for you to do.
it can be challenging. Yeah,
I
it
can
be sad.
imagine, because I think a lot of patients' parents or family, they're not ready to accept something, and they're going to, wait a minute,
Yeah,
wait a minute,
yeah,
what are you talking about? You know? And that must be very challenging for you to have to face. And do you sometimes physically face them, or do you talk on the phone?
Yeah,
or
we often physically face them, and
Yeah.
and that's why, you know, it's we always really encourage people to get that early consult to palliative care, so we can get on the case, so we can already start talking when it's not such a serious situation. We can already start talking about advanced care plannings and advanced directives and polls and what people's medical wishes are, because then, you know, when someone's faced with a really serious illness, it's always going to be hard, but at least if you've had that conversation with your loved ones, with your children or with your parents or whoever is the most important person in your decision maker, then at least, you know, your loved one knows what your medical wishes are, and it maybe makes it a little bit simpler because you know that you're following their wishes.
so how do you feel about people getting long-term care insurance?
You know, I don't know a lot about the insurance realm of things, but I mean, I assume it's probably a good
Well,
track
it was
to go down.
because
Yeah.
I had it when my husband got so ill,
Oh.
and I couldn't physically take care of him at night.
Oh, sure.
And he couldn't go to bed. He
Oh.
had to sleep in one of those lounge chairs that go back.
Oh dear.
But and I had to have someone come over at night so that I
Sure.
could sleep and then be able to take care of him during the day.
Oh, yeah.
And
Wow.
finally, we had to have 24/7 care because it was just impossible.
Yeah, it was too.
But I'm so glad that I got the long-term care insurance. It was
okay.
against his wishes to begin with, but I got it anyway.
Oh, well, good. I'm sure you appreciated
Because
it.
I was the one who was paying the bills.
Right.
And he said to me, because it paid 2/3 of the 24/7 home care,
Oh, that's significant.
which that's a lot.
That is
It really
significant.
is.
Oh, that's
And
good.
because Russ kept saying, "No, we'll get the money. We've got the money." Blah blah blah. You know.
Yeah.
And but like I said, I went ahead and got it anyway. And he said to me, finally, he said, "I'm so glad
Aw.
that you did that."
Oh, that's nice that he.
Because
said that.
you know, he would look at the bills we'd
Yeah.
get and finally saw that long-term care insurance kicked in and it paid, like I said, 2/3 of the bill.
Oh, that's great.
And that's quite a big portion.
It is.
And I still have it for me. I'm not going to
Okay.
give it up because
Yeah.
I don't want my kids to pay for me,
Sure,
you know.
sure.
They would,
You're right.
but why put that pressure on
Yeah,
them?
it could be a burden.
And
Yeah.
I think that's what a lot of people, a lot of
Yeah.
families need to think about.
Yeah, the burden of caregiving is
Yeah,
a lot.
It is.
Yeah.
And it's very expensive. Really is.
Yeah.
And I don't know whether you've experienced having to take care of a loved one.
Well, yeah, but you know, it's different. And what I'm more focused on right now is you've talked about the most challenging parts and the hard conversations. What do you feel is the most rewarding part of your job?
Sure.
Because there's got to be.
Oh yeah.
Yeah.
No, I love my job. I mean, I always say I have the best job in the world. I believe
Otherwise,
I do.
you wouldn't be in it.
Yeah,
You'd
yeah,
be in
yeah.
something
I
else.
believe I do, just because what I said before, how we are, I think, a very honest area of medicine. Yeah, the most rewarding part of my job is meeting a whole bunch of different people. No two patients are the same, even if they have the exact same diagnosis. So it keeps me on my toes. I'm always
Yeah.
learning. And then I'm getting to know people and I'm getting to empower them and getting to, you know, make sure that what they want for their health care is achieved. So I think it's a very impactful job and it's a great job. So I would encourage anyone that, you know, has a passion for this area to go into it. I don't think you'll never be bored. You'll always be challenged. And, you know, it's ever changing and evolving and you can make a lot of good impact in this area, I think so.
So,
Yeah.
so do you advise people
We do.
if they
Yes.
if they want to go this path
We do.
and you think that's
Yeah.
the wrong one.
Yeah,
So you let them know.
we do. Yeah, yeah. Yeah, I mean, we're nurses and we're physicians, so we have that medical training. So we do give people their options, and we do, if we believe it's medically, better to go a certain way, we do give our recommendations.
Terrific.
But we give all
terrific.
the options so
Yeah.
people can be informed in that.
Well, we need to
Empowered.
take a break, don't we? We've been chattering long enough, so let's take a break. I'm Barbara Cochran with my co-host, Dr. Thomas Bilecki, on your hometown station, 98.1 FM, AM 1220 KHTS. Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Thomas Bilecki, on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Sandra Wallenham. She's a palliative care nurse practitioner at Providence Holy Cross. And Tom,
So
you
there's
had some questions.
yeah, there's a lot going on there. I hope to give you the spotlight that you deserve.
Thank you.
First of all, we want to thank our relationship with Providence Holy Cross, an amazing organization, and nurses everywhere. Healthcare wouldn't work without nurses, period. There's
That's
no
very
question
true.
about that. But I think the elephant in the room is palliative care. As soon as you hear that word, it's like angel of death, right? And people, I didn't even know until working with you guys that there's a difference between palliative and hospice, and even hospice doesn't always mean end of life care. So can you help me?
Sure.
Help me explain that a little better than my rambling.
Yeah. So, like I said before a little bit, palliative care is really whole person care. It's care of patient with a chronic or serious illness that can use an extra layer of support. But with palliative care, all of your other physicians are following you. Still, the goal is for aggressive curative treatments. So we're really following along and supporting that patient because they have a lot going on. But we're just a medical specialty, so we're in the background. And in the foreground is, their oncologist, their cancer doctor, their kidney doctor,
Right.
really aggressively treating that illness. And so we follow along, and then at a point they might decide that they want to transition to what's called hospice care. So hospice care is very different because on hospice care now the goal shifts from aggressive curative treatments to now comfort-focused treatment and end-of-life care. So on hospice care, you're really not following a lot with your other physicians and doing aggressive treatments. Now you're focused on symptom management, comfort, quality of life. You're normally not going back to the hospital and things like that. And that's really the main goal on hospice care. Now, it's true, we've seen patients that have decided to transition to hospice care, and then they've gone on to hospice care. And because we're doing such aggressive symptom management, they actually thrive and do well and live longer than they would have if they were back and forth to the hospital receiving a whole bunch of aggressive interventions that weren't really helping their outcome.
Right.
So sometimes when we focus on symptom management and do hospice, people live, longer than even 6 months. The criteria for hospice is having a terminal disease and diagnosis with a life expectancy of 6 months or less. But that, like I said, sometimes people do well and the physician might come out and recertify them for another 6 months, or sometimes people, graduate off hospice because they simply are doing so well they don't meet that criteria anymore. So that's the big difference is hospice care is end of life care, and palliative care is really whole person care, but with the goal to continue with curative aggressive treatments.
Got it.
Yeah.
So and you are in the hospital.
Yes.
There's other areas of palliative care, but
Yeah.
you are on the front line
Yeah.
where these people need to be in the hospital.
Right.
That was the situation with Russ.
Right.
The doctor said, "Do you want to send him to a nursing home?" and that would have been the last place he wanted to go.
Right.
He said, "No, I'll stay here." And I did have, through Henry Mayo, I did have palliative care for him.
Oh, good.
And the doctor told me finally he has maybe 3 more days.
Oh.
And that's when they provided the hospice,
Yeah. Yeah.
because my kids were there with me. And
Yeah.
he passed away peacefully,
Oh, good. Good.
and
Yeah.
which was the best thing for him, because he was absolutely miserable, you know.
Yeah. Yeah.
He
yeah.
could barely speak,
Oh,
you know, and when I would tell him things that pleased him, he would smile, you know.
Oh, yeah.
So,
Yeah.
but I did have use of those areas at Henry Mayo, and they were, 'cause he was in there for 5 weeks, and that's
wow.
very unusual
Yeah.
for someone to stay in the hospital, because they want you out.
Right.
A
yeah.
couple of days out.
Right. Right. Right.
That's
yeah.
why they suggested the nursing home. you
Sure,
know.
sure,
And that was the last place, like I said, he wanted to go.
Mm-hmm.
And I would strongly agree with him. I wouldn't want to.
Yeah.
And since I've got long-term care insurance,
Right.
I can have somebody
You're good.
come at the home
That's
and
right.
take care of me.
Good,
And that's what I plan. Not anytime soon, though.
That's right. No,
I tell you.
You got a lot of life to live.
I'm going to be well into my 90s
Aw.
before I decide to
I
kick
believe
the
it.
bucket.
I believe it. I believe
Or
it.
even get into 100, which wouldn't bother me at all.
Aw,
As long as I
perfect.
can get around,
That's right. You have good
which
quality.
I can now, and
Which
I
is
don't
great.
use my walker anymore,
Oh yeah, nice.
except
wow.
at the house when I have to go potty real quick.
Sure. Yeah, you gotta get there.
And when you gotta go, you gotta go, you
Sure,
know?
sure.
So I'll
That
take
makes
that
sense.
walker and whiz around in there.
Yeah.
But normally I'm what'd you say?
No pun
No
intended.
pun intended.
You're gonna whiz around the house.
Oh, I didn't think about that.
Oh, that's funny. That's good.
Well, you know, nothing ventured, nothing gained.
Yeah. Oh, cool.
So you're
Yeah.
besides the technical aspect of your job, which is very demanding, the communication of your job, which is possibly even more demanding. How do you manage the emotional aspect of it all? I know there's a thing called disassociation where you have to maintain your objectivity and professionalism,
Right,
but that's not real.
Yeah.
It's just
Yeah.
not real.
You're
For sure.
absolutely
For sure.
right.
It's
So
true.
how do you do it?
Yeah. So this is something I had to learn a little bit early on, just working in the field of oncology, just realizing that, this is my patient's journey. It's not my responsibility to make sure they're going to have a certain outcome. I don't have that power. Really, my role is to support them, to ease their way through what they're going through, and to make it, a little bit easier for them, what they're going through. So I already had that kind of with me, but then also being in palliative, I agree. You don't want to shut down completely. I wouldn't be able to do my job effectively, and people know when you go in there and you're robotic and everything like that. People,
But you also have to deal with the parents and
Yeah.
the rest of the family members too,
yeah, you do.
which
Right.
I would think would be somehow very, very hard to do.
Yeah.
Because most parents are not accepting of what's going on with their child,
Right. Yeah.
And family members not really understanding what's going on with their mother or their grandmother
Yeah.
or their great grandmother.
It's true. And so, I don't take anything personally. I know that people are going through a lot. Some of the worst situations that they've ever gone through, everyone reacts in a different way. So I really don't take anything personally anymore. And I just try to lead, like I said, feel the room, feel where people are at, feel what information they could take in, always lead with compassion and love and honesty when speaking with people. And then just realizing that, some patients are gonna you're going to take home with you. It's going to hit you harder than other patients. And, it's okay to feel sad. It's okay to cry. It's okay to feel that emotion because it allows you to be human and to do your job well.
But
And
you have a family also, don't you?
yeah,
And that must be very hard, or maybe not now, since you've learned to
right.
take care of the situation. But that must have been very hard to begin with, having a family of your own and going through what you go through during the day at work. And then how hard is it to leave at work
Yeah, yeah.
and go home and take
Yeah.
care of your own family?
Well, I mean, it's like anything in life. It's all your perspective, you know what I mean? So, work can be hard, it can be emotional, it can be challenging. But then, really, the way I think about it is like, I'm blessed, my children are healthy, my husband's healthy, I'm blessed to come home to this situation and I can, feel really glad and happy and grateful.
You're going home to a happy home.
Yeah, yeah,
And you can leave
yeah.
the other mess
Yeah,
behind
I can
until the
I
next
can.
day.
I can make that distinction and kind of be able to be there for them and
I
myself.
would imagine it would have been very hard to begin with to do
It
that.
is. It is. I think it is for every single nurse, and I think it's something you have to learn pretty early on in your career how to do that. Because if you can't learn how to do that, you're not going to be able to maintain in the career.
Okay, well now while you're going through the schooling, are you also seeing psychologists and therapists as you're doing this
I mean,
that helps you
yeah.
come to those conclusions and
Yeah.
leave work behind and go
Yeah.
home to a happy family?
Yeah, so that's
That-
probably something that's lacking, for healthcare workers in general, is that mental health support and things. I think we're getting better at, realizing and supporting our healthcare workers, but I think we probably have a lot more, work to be done in that area. And, because we do see a lot and we do.
Burnout,
Yeah,
that
it's a real
especially
thing.
Yeah,
over those
I would-
past
Yeah,
few
the
years.
pandemic and
yeah.
everything. Yeah.
I would think
So, how do you see your field evolving?
Sure, sure. So I see it evolving, definitely. A nurse practitioner, like I said, is a registered nurse who's been educated on a master's level. So we have now a master's degree, and we are educated in a certain area of medicine. And so we are really there to support the ever-growing healthcare system. As we know, our seniors are just getting older and older and older. Life
And there's a
expectancy.
lot more.
Yes, there's a lot
Yes,
more.
they're
There's
getting
a
older.
lot more disease.
Senior boom.
Yeah, exactly. There's a lot more
Wow.
disease to be managed. There's a lot more
We-
people.
yeah, and
so
we have a very large senior population
Yeah.
in Santa Clarita. We really do.
yeah, I bet. So,
mean-
yeah, we really do support that patient population in particular. And so, yeah, I see it growing. Every state is a little bit different in the regulations on a nurse practitioner. But as time goes on, our scope is expanding and we're having more, area to practice medicine. So I think that, yeah, with those changing demographic of our seniors and our patient population, I think our field is going to grow. So it's a great area to go into if you're a nurse and you want to, expand your practice.
Do you have any specific advice someone considering entering the field at this point?
Yeah, sure, I do. So it's still so becoming a nurse practitioner, they still rely heavily on your experience as a registered nurse. So my advice would be to become a registered nurse and to get that experience as a registered nurse, I think you should at least have a few years working in the hospital, learning a lot about medicine and about nursing and everything. And then if you decide that you want to go further, have that baseline of knowledge so that way you can really thrive in a nurse practitioner program, because a lot of the programs really do rely on your kind of knowledge and experience that you've had already as a nurse.
Sure.
Well, what is a quote registered nurse?
Yeah, yes.
What is that? What does that title mean?
So a registered nurse is probably what you think of when you think of a nurse. That's the nurse you see in the hospital that's taking care of you for those 12 hours.
Yes.
So that's probably what you think of when you think of a registered nurse. However, they can work, in many different areas, outpatient, inpatient, things like that.
So, where does the title registered nurse come from? Do you go through certain tests?
Yeah,
And-
it's a 4-year bachelor's degree, and then at the end you graduate from college and take your national licensing exam, and then you are licensed to practice.
I see.
Yeah,
Okay.
yeah,
Wow. It's
Yeah.
a long process.
Yeah, it is. It
Wow.
is. It's a long process, but it's a big responsibility and a lot to know. So,
And then in order to be a palliative care nurse, you have to go further with education.
right. You can get your certification and things like that. So, yeah.
It's
Yeah,
good
it's-
if you start early
Yeah.
and start young.
Yeah. But however, a lot of really great nurses are ones that have that life experience. So
Yes.
that's okay too.
Yeah, so it's a calling for
Yes,
sure.
Definitely.
The hardest working, possibly least appreciated field in all of medicine. Not by me, because I know,
Yeah, yeah.
You're
and
not a
certainly
nurse.
not by the patients.
Yeah,
I mean, the
yeah.
patients get it.
Right.
In the short amount of time that they get to spend with their doctors, a lot of that is confusing and frustrating and just not really what that person needs in order to get better. Even if the doctor is amazing, doing
Right.
exactly what that person needs
Yeah.
to get better, the nurse does most of the
Does
work,
that's true.
most of the patient interaction. So
Yeah.
from the patient perspective, the patients get it.
Yeah.
They get it. I don't always know that the administration does, but I'm glad that you found a home at
Yeah.
Providence Holy Cross,
Me
because they
too.
are exceptional.
Me too.
Yes.
By
Me too.
far.
Yes,
Yeah,
definitely.
our
Agreed.
favorite
And-
sponsor.
Yeah.
And we need to take a break. It's that time again. I'm Barbara Cochran with my co-host, Dr. Thomas Pilecki, on your hometown station, 98.1 FM, AM 1220 KHTS. Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Thomas Pilecki, on your hometown station, 98.1 FM, AM 1220 KHTS. And we've been speaking with Sandra Wallenham. She's a palliative care nurse practitioner at Providence Holy Cross, one of our sponsors.
Yeah,
And
one of our
so let's wrap up, shall we?
flagship sponsor of the Senior Hour.
That's great.
Sandra, first of all, thank you for your service.
Of course, yes.
Nurses are on the front line of the battle that we all face. We'll all be in that fight at some point in
some
our
point.
lives.
Right.
So when someone says palliative care, immediately the association is, well, it's just pain management for end of life, right?
Right,
But that is not exactly what palliative care is,
Yeah.
right?
Not
So
at all. Yeah.
what's the big difference there?
So I think it gets confused because they go together in the same space a lot of times. Both palliative care and hospice have kind of an overarching theme of, whole person care, symptom management, taking care of that whole person, for who they are individually. However, they're very different. Palliative care is a medical specialty that comes on when a patient has a chronic or serious illness and could use an extra layer of support. So still the goal on palliative care, when you're receiving palliative care, is for aggressive curative treatments. Palliative care is a medical specialty, so we're interacting with the patient and the other medical specialties, but still the main focus and the main goal is for aggressive and curative treatments, whether it be, cancer treatments or, dialysis for end-stage renal disease or whatever the treatments may be. Now, at a point, that same patient may transition into what's called hospice care. So a lot of times we will have what's called goals of care conversations where we're talking with patients and families, we're educating them on their disease, and we're educating them on where they're at in their disease, and we're giving them different options. And sometimes one of those options is to transition to hospice care, where we are now not doing the aggressive curative treatments, and now the goal is for symptom management and support, and to focus on quality of life. So now we are, the patient does have a terminal illness that has a diagnosis of a prognosis of 6 months or less, and now they're just focusing on pain and symptom management, quality of life, and living the best they can for as long as they can, but knowing that they have limited time left. So that's the big main difference. And I think a lot of times people think, palliative care is hospice, and they, don't want palliative care. But really, studies have shown that when patients have palliative care versus don't have palliative care, they actually have a better quality of life.
Absolutely.
A lot of times they live longer even with, just receiving aggressive treatment versus, having aggressive treatment with palliative care. So there's a lot of benefit there.
Right.
There's a lot of
but
benefit there.
just having that extra added level of support.
Yeah.
And you say you work behind the scenes. So how do you advocate for the patient, for the family, and make sure that their primaries are, we're all working together?
Yeah. So really what we do is we have, no agenda when we're meeting with a patient and family. We really talk to patients and families. We listen. We listen to what's most important to them and what they want and what they need, and then we communicate those wants and needs to whatever member of the team will help us with that, whether it be a social worker, whether it be the primary physician, whether it be a speech therapist, occupational therapist. We work with all of those people. So really the key of our job is just, listening to people and hearing what their goal is and what's most important for them, and then helping them in achieving that.
Yeah, helping them get to where they should be.
Exactly, for what they want for their life.
Which is very hard to do, I would think.
It is. If you don't know medicine,
I don't envy your job at all.
Yeah.
It's very, very hard to do that.
Yeah. It's a challenge, but it's, like I said, no two patients are ever the same, even if they have the exact same illness. That's what, keeps us on our toes. And
But the other thing, too, is you have to have a positive attitude yourself.
oh, yes.
Because
Yes.
if you didn't,
Yeah.
I don't think anyone
Yeah.
would be able to do what
Yeah.
you do.
Right. Yeah. Well, I'm very lucky, like you said, to work at a fantastic hospital that we're well supported, and to work with a great team. I mean, even though our work is challenging and hard and can be sad, we still all love working together. We have fun at work,
Plus, you go
So,
home to
yeah.
a happy life, and that
Right.
really makes a big difference.
Yeah, it does.
Really does.
Yeah.
It helps you do a better job at work.
Oh,
You
yes.
have a happy home life.
For sure. Definitely.
it
Definitely.
really makes a difference.
Yeah.
All right. Well, thank you again,
Of
Sandra,
course.
for
Thank
all
you.
the work,
you
all
for
the
having me.
hard conversations,
Yeah.
all the challenges that we're all eventually going to face.
Yeah.
It's good to know that we have someone like you.
Oh, thank you.
We have a facility like Providence Holy Cross, one of our key sponsors of the Senior Hour for I don't even know how long, but a great organization, even
Yes.
if they weren't.
Agreed.
That setting the bar for care, not just here, but I mean in all of healthcare.
Yeah.
Amazing facility.
Agreed.
Thank you again so much.
You're welcome. Thank you.
You're welcome, and thank you for taking your time here. We get to see you one Wednesday every couple of months.
And tell Maui Kalani
Mm-hmm.
hello for us.
We will.
Yep.
I will. I will.
You've been listening to the Senior Hour, KHTS, FM 98.1 AM 1220, hometownstation.com.